Hi, we're back again. This is Dr. Herbold, and we're talking about carpal tunnel. So we went through the anatomy, we went through the physiology. Now we're going to talk a little bit about treatment protocols. So when somebody has carpal tunnel, the first thing to understand is where the entrapment or where the problem is coming from. We talked a little bit about the anatomy of it coming out of the neck. It can be affected by thoracic outlet syndrome, in particular if you have an extra rib or if you have some muscular contributions of tensions. We can also have a shoulder problem as far as entrapment. We can have an elbow and an arm problem, and we can have a wrist problem. So that having been said, understanding where it's coming from will affect us in how we address this as far as treatment protocols. What I do in my office is I do something called trigenics, and trigenics is a very interesting neuromuscular technique in which we look at the contributions of all the muscles that could be entrapping the carpal tunnel. So when we do trigenics, we always treat the neck, we always treat the shoulder, we always treat the elbow, and we always treat the wrist. Now somebody might say, well, that doesn't make any sense if it's just coming from the wrist. Well, that certainly is a reasonable way to assume that if in fact we get a decompression, if it's coming from the wrist, that we should fix the problem. What I see in my office frequently is it's not necessarily just coming from the wrist, even though if there's a pathology there, it needs to be fixed. But it's also a contribution of all the other areas. So we treat all the other areas with a technique called trigenics. Trigenics is a neuromuscular technique that reconnects how the muscles and how the nerves coming from the spinal cord and the brain affect the contribution of the endpoint itself, which in this case is carpal tunnel. Now beyond trigenics, we also have some pretty incredible tools for resolving inflammation and for healing. We have a 25-watt class 4 laser that has incredible penetration for pain and inflammation, and the laser also regenerates the nerves themselves from a healing perspective. We use something called pulsed electromagnetics. PEMF, as is referred to, is incredibly helpful once again for edema, swelling, inflammation, and also regenerating normal nerve function. Both of these tools together increase mitochondrial function. Mitochondria is the portion of the cell itself that generates energy. Mitochondria are incredibly high in concentration in muscles and nerves. So if we have a muscular problem, we just talked about that, or if we have a nerve problem, laser and PEMF are incredibly helpful for regenerating the contributions of how the nerve normally contributes to the healing process itself, or in repairing when something has been broken. Now ultimately, my board certification in neurology allows us to look at the contribution of the carpal tunnel to the brain itself. So the brain, as far as contributions to, let's say, right-sided carpal tunnel, there's a motor strip in the front of the brain itself which controls motion, and then there's a parietal lobe of the brain which has to do with the sensory input. So the ill effects of having something like a nerve condition like carpal tunnel actually changes how the brain fires out to the nerve and how that sensor or the receptor in the hand itself fires back into the brain. It changes not only the motor cortex of sending messages, but it also changes the sensory cortex. There are little pictures or maps in our brain, and when we don't use something successfully, the maps reorganize. As part of our treatment in dealing with things either chronic or even acute, we actually do the neurological work to clean up the mess in the brain from an area not working successfully. So we always take a metabolic perspective. So we look at somebody's labs, we look at somebody's physical examination, and we make sure there are no underlying issues. A lot of people are walking around with unexposed dysglycemic situations. What I mean by that is they could be moving toward diabetes or insulin resistance. Insulin resistance is a condition that precedes diabetes. Chronic anemias, vitamin D deficiencies. There's a lot that can be said or can be assessed by looking at a laboratory in what we call functional ranges. Functional ranges is when we look at a laboratory, instead of looking at pathology at the very end, we tighten the labs up by 20% and look at the efficiency of how your body is functioning. So understand my approach is very comprehensive. My credentials are board certification in neurology and clinical nutrition. So the approach that we take to resolving problems either acutely or chronically with carpal tunnel are looking at a big bag of tricks and understanding why something has occurred and how we can remediate it. So if this is intriguing, I hope you found this information to be helpful. My name is Dr. Richard Herbold. Welcome, and thanks for spending some time with us.